Hey, what's up YouTube, and welcome back to Morgellons discussion and microscopy videos. I'm your host Jeremy Murphy, and today I want to make a response video to managing Morgellons, talking about the patient experience. Morgellons is 100% not DOP. And you're absolutely correct. Morgellons is not 100% DOP, but what a lot of people mistakenly believe is Morgellons might just be DOP, and the doctors that they see are more likely to come across that than actual Morgellons disease. So you said a few things in your episode that I really wanted to touch on, particularly the old doctor creeping on you. Yes, that's totally uncalled for, and probably why a lot of doctors have to retire, if you know what I mean. Besides that, though, the doctor did say a couple of things that piqued my interest. First of all, he said that he sees this a lot in people who have experienced sexual abuse. I've been studying a medical condition recently called malignant syphilis. And just for the record, I want to be clear. I don't know if everybody knows this or not, because when I start talking about syphilis, people like to, but you can be born with it, okay? And, you can be born with syphilis, and you can progress into a late-stage scenario at like 3 years old and still continue to live. It might not kill you. It might really mess your life up. But, there are kids out there who have been born with Lyme disease, and they carry that infection with them through their entire lives. And the same is true for syphilis patients. But anyways, getting back to malignant syphilis, one of the factors that researchers have found recently in studying this condition is that people who have gone through sexual trauma and other traumatic events are more likely to develop that condition. And what it is basically is what they see most often in patients who are co-infected with HIV, the severe Morgellons ass lesions. And so, and I want to be clear about this too, okay? You can experience sexual abuse and be exposed to syphilis, and maybe Lyme disease too. The research isn't completely in on that, but I happen to think there's enough to suggest that Lyme disease can be sexually transmissible. So anyways, the doctor, he shouldn't have been getting up on close to you and giving you your space, definitely respecting what you were there for. But, like you said, he was old and just not thinking about, didn't have his eye on the ball, probably self-conscious, or what's the word I'm looking for? Confident. Probably lacked confidence in himself because he knew he was making mistakes. He knew he was heading towards that retirement. I'm not excusing what he did, and it's good that that office got that kind of behavior out of there, because that is something that it's not just Morgellons patients experience that. You know that. But another thing I wanted to touch on was the patient experience. For it to improve, patients have to be able to communicate with the places where they want to see that improvement occur. And they have to be able to do it in a way that those places are going to be receptive, because, the odds are stacked against us right now. I'm on here because I had a very similar situation to what you describe. I don't talk about it as much on here because I like to highlight the recovery if possible, but you really need to have what you need to get past a lot of things. And a lot of times it's very difficult to secure that, especially when you're spending a lot of money trying to not develop lesions on your body. But I want to say this. What really turned things around for me in regards to the lesions was getting a doctor who understood the supportive herbal protocol and the combination antibiotic therapy and which ones to put me on. Now, it's not her fault that I went through a bunch of bullshit and my cat died, but that happened. And those traumatic events will keep you from going into remission. You really have to have everything you can have. So if you have a car and you can go hike up the mountain, that's a little bit closer to being able to, and you're 15 years younger, then hell yeah, you're going to be closer towards remission than looking at the death. And that's really what I'm trying to avoid, is the death. And, not having the doctors understand what was going on, there was very few of them that would look at my skin like yourself and think that this was a self-mutilation, until it got to that one time after the CDC study in the ER with the dermatologist who got called in at late night. And that's understandable. But the thing is that he wasn't using that as a weapon against me. That was the training that he had been afforded and that the state certifies his ability to practice in against. I don't think that we're giving enough attention to the fact that more people mistakenly believe they have Morgellons than actually have it. And that's where you can get in with the doctor's offices, the institutions that you want to see that kind of change occur in. If you don't believe me, take a look through some of my videos. Take a look at my Quora page. You take a look seriously at these professionals that have started off not believing in Morgellons, and then see where they've ended up after I've shown them the evidence. But it was my approach. Because, and I guess it's my fault for having a lot of really crappy things happen, besides Morgellons, that to where I'm this way, to where I can be this way and be understanding, I'm really understanding because, I've done a lot of crappy things myself too. And I don't want to be that person, I want to be the person that does good things going forward. So to get there, you have to be able to understand the way people are and how to talk to them and the way they feel about things. If I was there, I probably could have talked to that doctor. It wouldn't have excused his behavior. You definitely, I agree with you. I'm glad that doctor's gone. And I hope you never have to experience that ever again. I hope no woman ever does. But we've got to be able to get into these institutions and say, hey, besides your doctors being creepy, we've also got this situation where these skin sores are demonstrated in the scientific research papers to be able to be caused by this tick-borne infections. And that's one thing a lot of people don't really understand about the new research paper, the case study, that I'm really trying to drive home. Because this thing says that, look, if you go to the health department with Morgellons lesions, they're probably going to refer you for direct testing for syphilis, okay? Because, to be honest with you, the infections, Lyme disease and syphilis, cause almost identical tissue damage, okay? So when the doctors are looking you over and they look at these, massive scars on your arms and they see them on your legs and on your back and everything, they've seen that before in syphilis patients. They're going to, want to look at your privates and see if you don't have evidence that you may have had genital lesions. But as we know, genital lesions, because of this case study, may be associated with Lyme infections. I'm trying to be very, very clear that I think it's so important that modern molecular testing methods, there's a cotton swab test for syphilis that's supposed to be done in skin lesions, should be done. Okay, I don't understand why we can't have a broad treponemal, and I think that's pretty much what we're going to end up with, is a broad treponemal cotton swab for skin lesions. But we're at that point where the evidence is there, and you can show these doctors' offices, you can show your state legislators, your senator and your congressmen and women that we're moving towards the molecular age, where if somebody walks in with a sore on their body, they may be exacerbating it by trying to debride it themselves. That may be occurring, but there's a genesis for the reason why there's a mark on their skin in the first place. And even Ekbom and V thought that there was an underlying process behind it. They didn't think it was the syphilis that their patients were infected with. But knowing what we know about what those infections can do, including increased collagen growth factor, syphilis can do that, then it's more and more. And you saw it with Dermatology Advisor, you see it with Medscape. They're finally going, okay, we've got some answers here. Well, we've got to do some investigations. That's what the Chinese Morgellons study says. It says, okay, you got a patient in there, and they're not saying nothing about Morgellons, but they got the sores on their body, and when you look inside, you can see the fuzz on them. You don't even have to have a microscope. You can see the fuzz on their arms. What the Chinese study is saying, and what the history of Morgellons and the classification and staging lessons from syphilis are telling us, is that the doctors should begin an investigation at that point. And more doctors, I think, especially now that they're starting to see the Skin Deep movie, which is really, wasn't going to hit right away, but I'm glad we've had some time with it, and now more and more people have actually seen it, are going to start that investigative process. But a lot of these institutions need a kickstart, and that's going to boil down to talking to your legislators about wanting to see that process change to where when somebody walks in with sores with fuzz on their arm, the doctor pulls out the microscope and tries to determine if they are embedded in their skin or not. And they know what to do if that's the case. And if they have to refer them out to an eyelids doctor, then that's where it's going to go. But I want to say this. Dermatologists, in my experience, when I've seen them, they've been able to clear up skin conditions as they happen. It wasn't until right about 2012 where they didn't become especially helpful. And we know that psychodermatology is really just the Western Hemisphere's version of dermatovenerology, which that's what the Europeans have. When they walk in, the first thing with sores on their body, the first thing the doctor is likely to say to them is, "Oh, you got syphilis." Not that you're crazy. So that's really going on, and that's been my whole point this whole time. But I just wanted to say, this was one of the first Managing Morgellons videos that I've seen in a long time where I really felt that vibe. That was a good video. That was a great video, as a matter of fact. And I totally agree with you. We need to get the sexism out of the medical profession and scientific profession entirely. And women need to be treated with respect. When they go in there, they don't need to be marginalized and pre-diagnosed before examination. What do you guys and gals think? Leave me a message. Let me know. I got to go outside and mow the lawn, so you know. We'll talk to you later. I got to do the wavy thing. Bye!